Hello, this is Dr. David Jones, and I wanted to go over some of the details after a total knee replacement that might be important to you. With a total knee replacement, the anesthesia we typically use is going to be a shot that the anesthesiologist gives you on the front part of your thigh that will numb up the front part of your leg for the first 2, maybe 3 days. That will hopefully decrease the pain a tremendous amount, but you still will have some pain in the back part of your knee. For that, I will go ahead and prescribe you a pain medicine. If you're having surgery at the surgery center, we'll have you get that ahead of time. Otherwise, that will be prescribed for you when you leave the hospital. Most people only spend overnight in the hospital, and some people now are going home the same day with a knee replacement. Physical therapy is going to be very important. Typically, this is going to be done as an outpatient, so you're going to need to make arrangements to go see the physical therapist ahead of time within a day or two of having had your surgery. In some cases, therapy can come to you, and that will be arranged either through the office or through the hospital as needed. The incision is going to have a clearish tape that looks like mesh on the incision, and it's going to be kind of super glued in place. I want you to keep that incision dry for the first 3 weeks. I want you to change the dressing every day, and if there are any changes, you need to give me a call right away. It's really important with knee replacements to do the physical therapy. I can't emphasize that enough. And if you really stick to it for the first 3 months, you're going to get better results than if you don't. As far as blood thinners go, you'll need to be on a blood thinning medication for 2 weeks. If you don't already take a blood thinner, most typically we're doing a baby aspirin twice a day now, and that's shown itself to be safe compared to a lot of the other more expensive blood thinners. If you have had a problem with clots in your family or yourself, then you want to let me know and we'll put you on a stronger blood thinner. Hope this answers some of the questions. And I would say that at about 3 months from surgery, most people are at about 75 to 80% recovered. If you really want to know full recovery for total knees or any total joint, it's probably a year from the surgery before you really know what your knee is going to be like. About 25% of it is the surgery, 75% is the recovery. So get ready to do a lot of good therapy and get ready to feel better from your knee replacement.